My job is to make you autonomous in the preservation and the restoration of your health. In this video, I will show you 3 different types of modalities with which I have good experience for helping you at a symptomatic level. But let me first explain why I care so much about you being autonomous. Well, it's simply because I do believe that if you're autonomous, you're free. If you rely on me, if you rely on your physiotherapist, if you rely on your chiropractor or your medical doctor to feel good, well, as soon as he or she is gone, you will feel bad. The other reason why it's important to be autonomous is that when you're autonomous, you can react just like that. Yeah. Whereas if you depend on someone, you need for this someone to be free before you can do something. And that someone can be on holidays, can be etc. And the result of that will be that your condition will be going worse until the person can see you. And by the time it's worse, it's more difficult to get better. It takes more intrusive, modalities to get better. And it basically contradicts the principle of the earlier, the better. Traditionally, I use 2 sets of tools with my clients and my patients. On the one hand, I have, I would say, coaching in biomechanics, which we could call posture therapy, posture re-education, or posture correction. This is about teaching you how to carry out your daily activities in a healthy way so that you don't damage your muscles and your joint throughout what you do at work or at home. Next to that, I use exercises, and exercises can be useful either for teaching you something, like if I want to teach you pelvic retroversion, pelvic tilt, well, there are 4 steps for that, and these are 4 types of exercises. Or exercises can be useful at a symptomatic level. That means that they will help, say, relieving tension somewhere, stretching a muscle, strengthening a muscle, relaxing a muscle. If we want to take the analogy of tooth cavities, posture re-education is about not eating too much sugar. And exercises, when they have a corrective virtue, are meant to brush your teeth. And basically, my job is to do exactly like your parents have taught you. Well, on the one hand, don't eat too much sugar. On the other hand, brush your teeth every day. So I give you the means to recognize sugar and fix it, and I give you the toothbrush. Now, we also have to be frank, and this is the purpose of this video. Sometimes we are stressed. Sometimes we lack energy, sometimes we lack time. And then, doing, say, a relaxation exercise, if you had a difficult day, I'm not saying it's useless, but it's not as useful as if you would have had a less stressful day. Because you're going to do the exercise in a tense way, whether you want it or not, it's not going to be that effective. Therefore, we need some other modalities that can help us when we don't manage to help ourselves. But with these modalities, we still want you to be able to use them on your own. I will describe 3 types of families: massage things, electrical things, and chemical things. Let's start with massage things. What I mean with massage is actually more trigger point massages, resolving the trigger points in your body, which I'm not going to go in detail about, because it's really well explained either in the trigger point manual or in the application book by Claire Davis. Yeah? So these are, say, the 2 Bibles of trigger point self-treatment. A very useful device for trigger point self-massage is this Theracane here. I bought mine, I guess, more than 15 years ago or 15 years ago. And you see, it's still there, it's still in a perfect condition. Many electronic devices won't have such a track record. So this is really a good tool. However, you see, it's a tool that is made of hard plastic. And to be honest with you, what matters most in trigger point massage is precision. And to learn precision, you need patience, you need calm, and you need, a bit of training. What I have observed by time, and this is linked to my personality, not necessary to yours, is that when it doesn't work the way I want, I tend to press harder rather than be more precise. And that is not a good thing, because it can create damage to the tissues. This will be especially the case if I use the Theracane against the wall, say for example to massage between the shoulder blade and the spine. Yeah, it works. I can be, very effective with it, but it takes some education. So my advice for trigger point massage is, well, get a course, and not a one-time course. Get like a coaching, meaning someone who will see you 2-3 times and who will really be able to monitor your progress. But Theracane is a good investment. On some other trigger points, such as on the forearm, I've noticed yesterday that actually a champagne cork does the job perfectly well. Because, you know, you can just make it on the wall and massage like this. And you can also find some massage balls, which are rubber balls, big or small. Well, smaller ones are useful for the forearms, for example, because the muscles are smaller. Now let's discuss electric modalities. Electric modalities is what can be called TENS. But actually, there are 2 types of electrical stimulations. There's TENS and there's EMS. TENS aims at the nervous system, so it's more for pain management. What I like to use is EMS. I mean, I'm not saying it's useless, but for most people, I first like to use EMS on very specific muscles, because EMS can, depending on the program that you use, help relaxing the muscle. And this is why I use this small apparatus, which is Böhrer EM41, or the newer version EM49, because it's both cheap and programmable. And I have programmed an EMS program with 2 Hz, so 2 times per second, tick, tick, tick. The muscles are, say, contracted by an electrical impulse. And, you know, when the muscle contract, relax, contract, relax, contract, relax, after 30 minutes, it's tired of playing your game, so it stays relaxed. Another patient of mine has recently bought this other device and he has a very good experience with it. I must say I've been impressed with it also. It's much more modern than my old Böhrer. It works with a smartphone. It's also much less invasive. You don't have cables everywhere. So if you have a bit more budget, that can be a very good alternative. The last device I'd like to show you is this one. You know, this one is both crap and extraordinary. Why is it crap? Well, because look, mine fell, the screen is off, the cable here is actually broken, and you know, the thing is a whole mess. But why is it extraordinary? Because despite the fact that it's into pieces, it still works, and it still works very fine. What I like with this one is it is equipped with a function to help you locate trigger points where you can massage, which are actually the acupressure points. And the function works either with a visual indicator showing a number. The bigger the number, the closer you are to the area to massage, or with the beep. The beep is less precise. And you see, I mean, this one is broken, but it still works. So I would say for people who really want to, you know, study the charts for trigger point massage and things, well, try and get this one. Be aware that it's crap quality, but it brings very interesting results. The last modality that I want to describe here is what I call the chemical modality. It's actually the use of this Erskine yellow spray, which is cold then warm. What I've found is that it's extremely useful to actually carry out the technique called spray and stretch, which is described by Travel and Science in the trigger point manual. The basics behind this technique is that you actually spray the muscles across a very large area before stretching them, and normally in the traditional technique you will then use moisture heat, which is, you know, the blue heat packs that you can microwave. What I found is that if you use the Erskine yellow, well, not only you get the the good effects of the technique on the stretching technique, so it reinforces the stretch, but from a logistic perspective, everything is much simpler because you don't need the heat pack, therefore you don't need the microwave, therefore la 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 la. All the technical modalities that I've showed you have been carefully selected so that you minimize the risk to hurt yourself. Bear in mind that it's always better to do a little bit not enough rather than a little bit too much if you're in doubt. If you are aware of any other great technical modality that people can use risk-free, well, drop it in the comments below. I don't mean advertisement for things that you sell. I mean really true and honest advice on things that you have used and that you'd like to share with the other viewers of this channel. For the rest, if you need more information on what I was describing in the beginning of the video as not eating too much sugar and brushing your teeth, well, I can gladly have a chat with you on the online posture programs. Just drop a comment below and I'll send you a link to my schedule so that you can book a call.